You're watching Good Day Central Illinois on WYZZ.
Welcome back. Well, tattoos have grown in popularity over the last 10 years, but what are the health risks of getting one?
Now this morning we're sitting down with Dr. Brian Curtis. Wow.
That's good.
It's not like I've known you for over a year.
I'll tell my wife we're changing it.
Well, we're discussing some of the latest research on tattoo health. Good morning. I won't mess up your name ever again, I promise. All right. So how much has tattooing grown in popularity?
Yeah, so it's gone from about 20% to about 30% from about 2010 to 2020. So it has been increasing over time.
Yeah, I mean, I feel like there's not many people who don't have one anymore.
I don't have any tattoos.
Okay, well,
sorry.
That's fair.
But when people do get tattoos, I mean, what are some of those health risks that come along with it?
Yeah, you know, so the biggest thing is just to make sure that you're going to a reputable tattoo parlor that's licensed by the health department. The biggest risk, honestly, is bloodborne pathogens, and that's what the health department makes sure that they have a bloodborne pathogen policy and they follow it.
So what is the research that, has gone into that to kind of make that finding?
Yeah, so this was done in Sweden, and they were kind of seeing the trend of the tattooing, and so they looked over about a 10-year period. Now, Sweden has a national health service, so they track everything, and so they tracked for 10 years and did a survey, found out about 20% of the population in that 10 years had a tattoo, and then they looked, and the odds of having a lymphoma was about 22% within that population.
I mean, how much? I mean, this can be a little alarming for some people with tattoos. I mean, how much of a risk is there? I mean, how much should people with tattoos be worried about whether or not they're going to develop lymphoma?
Yeah, so when you looked at the study, there was, it was kind of more of an association. It was a very, very weak association. There was no correlation between number of tattoos or the size of the tattoos, which you would think there would be. And so really, it probably wasn't. It was just kind of that, it was a spurious event that occurred within it. It wasn't like a direct correlation. Tobacco causes cancer. We know that, and so this would be like a lot of people in accidents wear seatbelts. Well, that's not true, so.
Well, so obviously the people who want tattoos are going to get them whether there's health risks or not. So what are some of those risk factors or preventative measures that they can take to make sure that they don't have lymphoma or they aren't getting the side effects that, some people might get?
Yeah, so first of all, lymphoma is very, very rare. So about 22 people out of every 100,000 will develop lymphoma. And so really, if you want a tattoo, get a tattoo. And so I was just more concerned that this was everywhere in the print media. And so the biggest thing, again, is the bloodborne pathogens for the tattoos. And that's it. And most of it's like a hepatitis C, which is very contagious, and it's a bloodborne pathogen. So really make sure that your tattoo parlor is licensed, maybe not get it in the back room of somebody's house, probably not the best idea. And so, really to be sure of that.
Yeah, that's probably the best way to do it.
Very true.
Yeah, I mean, clean needles, right?
Always.
Clean needles. But,
Yes.
Dr. Curtis, thank you so much for joining us this morning.
Thank you.
Of course.